So I passed my general practice exams. It's been 5 years now as a doctor, and what I want to show you is I want to show you what I've been using as my Notion page for the last 2 years. This is a genuinely gigantic document. Like it's freaking massive. And this page has every single topic that I covered in medicine ever. So basically every single medical condition is in this one page. I did pretty okay on my general practice exams, so I got the top quartile and stuff for like, you know, some of my exams. This Notion page is something that shouldn't work, but does. And I really want to show you it. I want to study in a way where I could memorize a lot of things very quickly and cram very, very hard, because there was a lot of conditions to study for this general practice exam, because you literally don't have one specific specialty, you have to cover every specialty. The other neat thing about this particular thing is that it actually utilizes evidence-based techniques like active recall, spaced repetition, and I'm going to teach you how to do that. I don't know if anyone's talked about this specific way to do it because I made it up. Anyway, let's go through it. I think you'll find it kind of interesting at the very least, even if, you know, it's just for entertainment's sake. Let's start off this page, aptly titled Every Topic in Medicine, because that's literally what it is. Like, I cover cardiovascular disease, dermatology, hematology, musculoskeletal, pediatrics, whatever it was. And basically all these topics each have their individual headings. So for example, let's go down to the respiratory section, where, you know, I've got lots and lots and lots of toggles. Like every single condition, and even some subsets of some conditions are toggles. The reason that I did it like this was, one, I wanted to have a high level overview of everything in a particular specialty, so I can be like, oh, okay, like I can look at the stuff that I think is important, like asthma, COPD, for example, and be like, okay, like I know I need to cover those for sure, so I can just quickly look at those and go back to it. So the whole idea behind this is you want to use active recall, and if you haven't heard of it, although I'm sure you have if you're on this side of YouTube, but basically active recall is where you're asking yourself lots of questions, and rather than just trying to passively read through stuff, you're actually testing yourself on these questions, which is actually a much more effective way of learning. For example, this toggle list says treat mild COPD, right? So the idea is, if you see this question, you want to just take a guess as to what you need to do to treat mild COPD. So for example, I might be like, okay, treating mild COPD, well, you know, I suppose you could treat it with like a Ventolin or short-acting beta agonist, and you know, if it gets a bit worse, you could treat it with long-acting muscarinic agonists or long-acting beta agonists. For mild COPD, let's have a look. And here, now, the first thing you'll notice, now keep in mind, this is a very lazy system, right? So what I've done is I've literally just copy and pasted this table very, very quickly. So to actually make this note was super duper quick. In fact, I can probably show you the exact website that I copied it from. Give me one second. Okay, so I found the website that I wanted to copy it from, this table, right? What you want to do is you want to try to reduce the amount of time it takes to write notes, because writing notes, although it does help you think, and I think that that's an important part of things, but when you're doing it across hundreds and hundreds of conditions, that quickly becomes untenable. It's not very good for your fingers because you tend to get arthritis. By using this quick copy-paste system, like there's some stuff you just need to memorize, like a table or something like that, then you might as well keep the original format so you don't have to retype it out. The key thing that you want to be doing is thinking, not writing. What I would do here, for example, is I use a technique to copy and paste things with Control F. I've actually talked about this technique in another video about MacBook productivity, and so I just literally copy paste and then put that into here and then copy paste that into Notion. So I know how to treat mild COPD now, and so now that picture will load into there, and I'll just duplicate the picture twice, obviously because it's already got one, so I'll get rid of that. And then I can just, you know, if I want to treat mild COPD, I'll be like, oh look, short-acting beta agonist. So I thought the whole idea is you want to phrase as many things as you can as questions. How would I be tested on this in real life, or even in, you know, as a doctor, for example, like how does this situation crop up in my life? That's how I'm going to ask the question, and therefore that's how I'm going to be able to learn it, so that if the question does come up in real life, then you can be like, oh, like treating mild COPD, you just do this. Let's go to something different. Okay, this is a really, really good example. So this is talking about asthma. So basically for asthma, like you might want to think, okay, like what are the definitions? Like you can see that this is a really kind of a lot to memorize, right? This is hard to memorize because there's just so much stuff to memorize. Asthma itself is like not too complicated, but trying to memorize all the specifics of asthma does take actually a fair bit of work because of the depth that you can go into it with. So like, for example, like what's the stepped approach in adults and adolescents in terms of asthma management? Well, if you actually look at the note here, and again, copy and pasted like a true lazy person. Here, I've got this exact thing. Few patients I need to start alone. Most patients probably need regular low dose ICS, and blah, 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 blah. So by doing this, you can really amp up the amount of active recall that you do, and you don't have to think too much about the structure of your thing because, well, literally it's just organized by specialty, and each specialty has different medical conditions. That's pretty convenient for something in which you're talking about specialties. So I'm doing general practice, so that's actually quite easy. But what if you're doing something like pathophysiology or that sort of thing? Well, I'd probably just put that into a separate category and also just create a few questions on that. It's basically exactly the same thing. You still want to maybe phrase the questions in your own way. So copy and pasting is for the ultra lazy like myself, but really you do want to be understanding the stuff that you're doing. So if you copy and paste something, you don't really get it, but you copy and paste it anyway, probably not the best use of Notion or like learning in general, because perhaps the best thing you can do is try to make it as simple as you can. Make it use analogies, for example. I always think about hypertension as being like a balloon, and then you put more water into the balloon, then you get more blood pressure. Let's say you want to think about the consequences of like a subarachnoid hemorrhage, for example. Well, what happens? Just try to think of stuff simply and try to explain stuff simply, and then you'll find that if you want to go into the more complicated stuff, like you could. In my mind, it's like much simpler. It's kind of like skull equals box. Box contains brain plus blood. Too much blood means brain have to go somewhere down. Like, I just think of stuff like that. So that makes it easier. One thing about this particular document is that you can see that I've got a big table of contents at the top, and this is actually a dynamic table of contents. So it's kind of cool. Like if you just press slash and then table of contents, then it will actually generate that. And this is a table, which means that you can actually click on any part and then immediately go to that. So I put that right at the top because that's super duper useful for like being able to navigate your gigantic Notion document. Now keep in mind, what I initially started doing was I was like, oh look, if I have topics that I'm pretty happy with, then I'll just like highlight in green so that I can go through each individual topic. There's some stuff that I felt like I didn't really know that well, like for example, peripheral arterial disease. Like when I went through it, I was like, crap, like I can't remember like the different things, like examination fine. Well, I remember some things now, but I just did not know like what to do about these different things, right? So I highlighted in red just so I can go back to it and be like, like I probably need to work on this area a little bit more. Now, before like someone goes and decimates me in the comments, the thing that you want to think about with this is like, this is a heck of a lot of information. In fact, this is way too much for like a lot of people. And that's fine, because what you really want to do is to actually put some of the hardcore stuff that you need to remember in spaced repetition. And so the way that you do that, and this is actually where this becomes a really powerful technique. If you, for example, so this is my obstetrics and gynecology page, right? I always have a really hard time memorizing obstetrics and gynecology stuff. So what you can do is you can actually create a separate page. And what I've done is in this separate page, I've actually copy and pasted a bunch of toggles from the first page and include only the most important parts of those toggles. Basically what you want to do is you want to just open up two windows. You have one window which is a new page, so you can open that there. I'm going to call this Notion to Anki Gynecology because that's the name of the software that we're going to use. If you've been following this channel for a while, well thank you first of all. That is a piece of software that allows you to turn Notion toggle lists into Anki cards. Anki is by far the best software for doing spaced repetition. Look, I've tried other stuff, it's just not as good. What I do is I'll take like individual toggles, for example, like let's say abnormal uterine bleeding testing. So I might just copy and paste this and then put this as like an actual toggle here. Oops, sorry, you have to actually highlight the whole block. So I'm gonna do that and then put this as a tool right here, like this. If you want to do, you can paste and sync so that if you change, this page, then it actually reflects onto this page as well. And then once you've done that, you'll get a sort of fairly big list of stuff that actually matters. So for example, what I did, and this is probably a better example, this is the hypertension guidelines that I decided to make a Notion to Anki version about. I've got a gigantic note about hypertension in my gigantic toggle list too, but what I've done is I've literally just made the toggle list of stuff that I want to memorize hardcore, right? So I still have it here in Notion to Anki, so I have a database that I can reference at any time and just do a parameter at any time. But for stuff that I wanted to memorize hardcore, I just chuck into here, and like I want to keep it as maybe the top 60 or 70%, like the most critical 60 or 70% of stuff that I need to memorize. If it's like bottom 30%, bottom 20% of stuff, like you might want to know about it, but memorizing is a different story. So you can obviously change those different parameters how you want. So you might decide to only memorize 20% of stuff and then just look up the other 80%. For me, I think trying to memorize about 60 to 70% of what I need to know. It's probably about a good marker. And then the other 30%, if I happen to remember at the time, cool, like that's great. But you know, it's not absolutely critical to remember, unlike this stuff. So for example, knowing what blood pressure measures correspond with the diagnosis of hypertension, like that's kind of really important because otherwise you can't diagnose it in the first place. Diagnosis and management of hypertensive urgencies, like that's important. So each of these individual toggles, like these will become the question cards in Anki, and then when you open them, that will become the answer card in Anki. As you can see, I've just copy and pasted it there. I've done a whole video on Notion to Anki, so I won't talk about it anymore. You can check out that video. Maybe I'll go through a few more examples just to sort of hit the point home as to what you can actually do in this. So let's say approach to red eye, which I've highlighted in yellow for some reason. So here, this is a bit different because it's not just the condition, this is like actual clinical presentation, right? It's like, what's the differential diagnosis of red eye? Well, I could think of a bunch of stuff. I could think of like glaucoma, iritis, conjunctivitis, foreign body, you can think of like scleritis, episcleritis, like there's a whole bunch of eye stuff that makes your eye red. And so like, you know, going into that, there's probably a lot more that I forgot. So yeah, I mean, you know, I didn't think about starting collagen necessarily. I didn't really think about corneal ulcer. That's probably a really good one to not forget, and a corneal abrasion. The whole idea is like, it's fine to make mistakes when you're doing active recall, because that's kind of the point. Like, mistakes make you better. That's why like doing practice exams makes you a lot better than just trying to read a textbook. Something, if you feel like you want to, you know, go extra hardcore, is that you could write. Like, I used to have a mistake book where I literally would just physically write all the mistakes that I made, and that's called my diary. Just kidding. So I used to write all the mistakes that I made so that I would learn from them when it came to like clinical questions like this. With regards to when this page started off, it didn't start off all as toggles. It actually started off as bullet points. So for example, here I've got an incomplete dermatology thing, because it's actually only incomplete because I've actually got this in Anki already, so I didn't really do it. But like, I had a whole list of topics and I put them as bullet points. So that means that when I could actually go and cover it, I would turn it into like a toggle list and then write into it. That way you can get a really high level overview of what you need to study, and that way you don't have to think too much in advance about what the structure of your particular note is going to be. But you still have a way to like cover everything, because it's really important when you think about, you know, when you think about studying and you think about life, right? You want to think about the big picture first, and then you go down to the small picture. You don't want to start with the small picture, because you just don't understand what you need to do, where everything is, how everything connects. What I could sometimes do is, this is interesting, so like sometimes like for our particular exams, you would need to include like a certain number of points in order to get the marks for a particular question. And you don't always know, especially when you've got a huge document like this, like there's no way you remember how many points are in a particular question. So like having the number 7, I was like, oh, okay, like there's 7 things that I need to talk about in regards to history. I need to take the red eye. It's just so I can have a number to be like, okay, like if I only got 2, well, there's more that I need to think about, right? So let's say like I need to be like, yeah, do you have any visual loss? Do you have any foreign body sensation? Do you have any discharge coming from the eye? Do you have, I don't know, flashes, floaters, whatever. So yeah. And then if I forgot something, then I'll be like, oh yeah, well I've only got 4 things or 5 things that I mentioned there, but I probably missed another 2, and maybe I could have asked this or this. Let's look at a more basic note maybe, just because it's probably useful to illustrate these sorts of things. So like diabetes management. So here's a really good note actually. So what are the clinical management goals in diabetes? 15! Because so much for diabetes, right? Fundamentally, you have to, when you get a question like this is really interesting actually, because like, it sort of means that in your mind you have to be like, oh yeah, damn, there's a lot. And so if you ever go ask that question, you're like, oh man, there's a lot, right? And then in your mind, logically, what naturally tends to occur, you'll be like, oh, okay, well, let me think through this logically. Let me think, okay, how can I break this up into categories so I can at least remind myself that these things exist? So you might be like, okay, well, diabetes, I guess you could think about the non-pharmacological stuff. So for example, smoking, nutrition, how much exercise someone needs to do, how much weight they need to be at. And then you would think about the different parameters that you might try to achieve within that. For example, let's talk about nutrition, right? You would think about, okay, generally aim for having low GI foods. With your weight, generally aim for like, you know, not being overweight or obese. Things like pharmacological things or clinical parameters like hypertension, like how much you want the blood pressure to be, you can think about that. So, you know, you just, when you get a gigantic list of stuff that you know you have to come up with, I think your mind sort of is like, okay, how can I like subdivide this so I can make my life easier? Here I've made it easier for myself. For example, describe in detail the non-pharmacological management in diabetes. Lose weight, do physical exercise, maybe, you know, 30 minutes over 5 days, for example. Well, that's just like the standard. There's probably something specific here. Alright, so see, like here, I didn't remember the bariatric surgery bit. I don't think this is a well-written question, but like sort of got it right. 30 times 5, Mediterranean diet specifically, and bariatric surgery of BMI over 40, for example. And here I've got another section here which is just talking about detail, because like, this is a good example of me trying to, you know, do something where I've written something down, but instead of just copy and pasting, because copy and pasting, as you can see here, was like gonna be way too much. Like, you know, who has time to like memorize all of that? So instead of that, it's just like exercise, diet, bariatric surgery, okay, done. So that makes your life a lot simpler, makes it so that you actually understand things, because it's better to recall 100% of something than 0% of a gigantic piece of like information, you know? How would you approach commencing medications in type 2 diabetes? So, you know, you might be like, okay, I just memorized this whole gigantic table where it's got like metformin down the bottom, it's got everything else next, and then it's got insulin at the top. And here, I've actually made it more hardcore for myself by including individual doses, because for my fellowship exams, you actually need to include the dose as well. So this is stuff where like this stuff could potentially be stuff that goes into Anki because it's hardcore knowledge. There's no rhyme or reason to why particular medications are particular doses. You know, a camprosate is going to be like what, 666 milligrams. Why is it like that? I don't know. Why do they do that? Who knows? Trying to put in hardcore memorization stuff. This is stuff that's really worthwhile to go into that separate Notion to Anki page and then go into Anki. One thing that you might have noticed while looking at this, and you know, this is probably useful for the more perfectionistic type people of us, sometimes like it's very tempting to cover a topic multiple times because we don't remember that we've actually learned it. So what I did was I just put ticks onto the headings. And so it means that it came up when I actually put it onto the table of contents. As you can see, there's actually a lot of stuff I didn't cover properly. I still did okay. So, you know, I guess I didn't need to know everything about every topic in medicine, but like at least I could be like, oh, well look, yeah, I feel like gynecology is always my weak spot, but I've covered it, so I really need to move on and actually not dwell on it too much and actually try to cover some of the other stuff. To answer some questions that you might have, so let me scroll this entire document. Okay, so look at the scroll bar. Okay, I don't know if you can see that, but that scroll bar up there is literally like 5% of like, or maybe like 3 or 4% of like the entire like scroll thing, right? So this is a genuinely gigantic document. Like it's freaking massive. The question would be, you know, can Notion really load that many things into one page? My answer would be, if you have a computer that's at least 2017, 2018 with like a decent amount of RAM, like 32 gigabytes of RAM, no problems, my Mac would handle it. 16 gigabytes of RAM probably would struggle. The way you sort of get around that if you have a Mac is that you actually access this page in Safari. That somehow makes it a bit easier for it to load if your Mac is not, you know, as powerful. At the moment, I just upgraded my computer to the M1 MacBook Pro with the Pro Max chip. So it's like this super duper intense computer. This Mac is gonna have no problems. But for the majority of like people that are like less weird and have more normal computers, a Mac with probably 32 gigabytes would probably be okay. Windows, you know, it may load a bit slowly. Look, if it really does load that slowly, you could just separate it into different pages. That's probably the more logical way to do things. And it wouldn't necessarily be that much different in terms of being able to access stuff and look at stuff. So you could separate it like that. I just like the idea of having like one gigantic page so I don't have to think even about accessing different pages. I can just look at everything at once. So to sort of summarize this system, every heading is a specialty. Every toggle is a clinical condition. I suppose if you're studying at the university degrees, it can be some other sort of topic. You summarize the main parts into a separate page and you export that page as a thing in Notion to Anki so that it converts into Anki cards and you can actually memorize it in Anki itself. And yeah, that's about it. So very, very simple page. It almost doesn't seem well thought out. It's definitely a big contrast to people's very organized workflows in Notion with lots of categories, with formulas that allow you to do spaced repetition and stuff like that. Like, it's very impressive stuff on YouTube, but this is what I used and I did okay. So, you know, if you want to just use this and think simply, this might actually help you. And then you don't have to think too much about the structure of Notion and just actually get on with the actual work itself. All right, that's a wrap. Thanks for watching. And yeah, so one last thing. Sorry about if you're not interested in Notion at all and this video is popping on your feed. I haven't yet decided what precisely I'm gonna tailor this channel's audience to. I just want to make helpful stuff, and you know, if you find this helpful, even if you're not a medical student, then you know, that makes me happy, I guess. So my channel, maybe I'll niche it down to one particular audience at one particular time, but for now I just want to talk about everything from being an anime character to Notion. It'll probably niche down soon when I actually think about a proper strategy. For now, I hope this is useful, and feel free to stick around for the next video if you're not subscribed. If you are subscribed, thank you very much, appreciate it. Catch you in the next one. Bye.